Namaskar students. So here I am with another prosthodontic lecture for you. Today we will be discussing a very important topic of complete denture, that is history taking of an edentulous patient. You should prepare this topic well for your chairside viva if you are appearing for your final year BDS or your MDS exam. Besides, it has much clinical importance that you cannot ignore. So let's start history taking of an edentulous patient. So dear students, we will be discussing this topic under three main headings, that is the patient's data, medical history and the dental history. In the patient's data, we should record the name of the patient, age. Sometimes we don't get the exact age, but yes, the age group will also do. Then comes the gender, address, occupation and the social position the patient is having at present. And lastly, the cosmetic index. Name of the patient signifies the identity of the patient. We as a clinician should address or call our patients by the name, which actually helps in gaining the confidence. As we are dealing with the geriatric patients or the old patients, so we should give them regard by using the words like Auntie G or Uncle G. Now, age. We can categorize our patient according to the age as below 40 years, 40 to 60 years and above 60 years. Patients with below the age of 40 years are very few. And if your patient belongs to this category, then try to find out the reason of the complete extraction at this young age. Rule out if any systemic problem or any ignorance of the oral health is associated. This group is usually adaptable to change. Their tissues heal rapidly. One important thing to consider is that males especially may be at the height of their career, so they may be busy and impatient also. Their appointment adjustment and counseling will help you in treating them. Patients of the age group 40 to 60 years. They may have slow healing as compared to the previous group. Their mental attitude also may not adapt to the new situations. Females of this group, they need more concern as some of them may be undergoing menopause. So the hormonal changes which may be present. These may range from physical to psychological problems. Burning mouth syndrome, xerostomia and mucosal changes are commonly associated, which needs lot of consideration. You may also find them with psychological distress. They may be easily irritated and complain of vague pain. Patients of above 60 years are difficult to adapt, so they need to be counseled right from the beginning. Their tissues repair is also very slow. We can find compromised denture supporting tissue, especially for the long-standing edentulous cases. Many of them give history of medical or systemic problems, or they may be on some drug therapy. This we will be discussing in detail. Some of them may also have partial or complete hearing or vision loss due to the aging. Now, your question in Viva. Examiner first asks you the age group of your patient, then the importance of the age and the problems associated with the age group. So if we talk about the difficulties of the patient above 60 years, first is the adaptation to the dentures or the new dentures especially. Then the neuromuscular coordination that you need at every step of denture fabrication, right from the impression till the insertion. Excessive ridge resorption results in poor retention. Tissue sensitivity, delayed healing that has to be cautiously handled. Balanced nutrition may be lacking in these kind of patients. Communication may be hindered due to the problems like hearing or the visual loss. Gender, a well-known fact that women are difficult to please. It applies for the elderly group also. Before it was a saying, now it has been published. Women are more concerned about the looks or the aesthetics. Their expectation may be more sometimes, and it may be sometimes unrealistic also. So the only way to satisfy them is talking to them, listen to them patiently, and then tell them the facts that are possible. Men comparatively expect comfort and the smooth functioning of the denture. As we discussed earlier, that many of the female patients in the fourth decade may be undergoing menopause. They are difficult to manage due to the psychological distress. Patient may show irritability, eating disorders that lead to angular cheilitis. She may complain of generalized pain. Dry mouth or xerostomia is also common in these patients. Now, how to deal with dry mouth and these conditions I will discuss in the examination section. Burning mouth syndrome is also associated with these. On examination, the mucous membrane may be sensitive, it may be glistening and atrophic with edema or reddening. In severe cases, blisters may be present filled with serous fluid, followed by sloughing. So symptomatic treatment should be done. Symptomatic treatment is required before going for the denture fabrication. Address of the patient mainly helps in keeping the records. Some diseases may be region specific, so that may need consideration. If we talk about the occupation and the social position, higher the socio-economic status, more demanding will be the patient. Now this is quite obvious. An educated patient can understand and appreciate the limitations associated with the artificial prosthesis. He will also understand the steps and the time that is needed for the fabrication. He will also understand the maintenance part nicely. Along with, we need to know the working hours for the patients who are still in office for easy appointment. Profession do influences the making, using and maintenance part of the complete denture. A speaker in any field needs to address publicly, so he will be concerned about aesthetics and phonetics. So as a clinician, we should take care of the teeth selection and the placement of the teeth. Interior guidance plays an important role for giving the clear speech to the patient. Besides, the denture characterization and the liveliness will be appreciated by the patient. A teacher will also have same concerns and need to be managed similarly. Then the main concern for a musician or a singer is also good looks and clear speech. So we need to consider again the teeth selection, keeping all the factors of dentogenic concept in mind with proper teeth arrangement, especially the interior teeth placement, the visibility, the lip support and the lip fullness. An executive person mostly is under continual stress. So he may have bruxism tendencies. Removal of the dentures at night are a must, along with good options for the teeth materials. A factory worker may be exposed to the abrasives. So again, strong denture teeth material are needed to be considered. Cosmetic index. It shows the aesthetic expectations of the patient. It can be classified as class 1 high, class 2 medium and class 3 low. Patients with high cosmetic index are exacting in nature. They are more particular about what they need. Along with, they are appreciative and cooperative also. Patients with the low cosmetic index are often indifferent. Medical history. Examiners are very fond of this topic. They may ask you the management of any of the major medical problems. Very tricky MCQs are also framed from this part. So let's proceed. We all know that a patient with good health will accept and adjust better. The patient should be asked politely and formally to disclose any kind of major ailment if present. Some patients cooperate very well and they themselves take the initiative to discuss, but some try to hide. So on the other hand, you can ask any medicines if the patient is taking. So this will reveal any kind of medical problem if present. Cardiovascular disease. Most commonly, the patient gives the history of cardiovascular disease. In his terms, he will say blood pressure. So ask him high or low. High blood pressure is more botheration for us. Now try to understand it carefully. Any stressful procedure will stimulate the discharge of epinephrine and norepinephrine into the bloodstream. This elevates the blood pressure, increases the heart rate, and places the strain on the entire cardiovascular system. Our appointment will not be invasive, right? Our appointment will not be invasive for complete denture fabrication. Only the thing to be considered is that we have to make our appointment as less stressful as possible. Dear students, examiner oftenly asks this topic. He mainly asks you about how will you manage a patient with cardiovascular history while fabricating the complete denture. So this should be your answer. First of all, patient should be made comfortable and relaxed before treatment. Explain whole of the procedure and duration of the to the patient. This will reduce the anxiety of the patient. Long fatiguing procedure must be minimized and short appointments should be given to the patient. In case the clinician has a doubt, it's better to discuss with the physician. Patients with a cardiovascular disease is often on the antihypertensives. So let us know what are its side effects and how to manage it. These patients are more prone to nausea and vomiting. So care should be taken during the impression making, that is, no overextended trays should be there and less material should be used. Also, the overextended denture bases should be trimmed before doing the jaw relations. The second side effect is postural hypotension. Sudden rise or change in the posture can cause temporary loss of the consciousness. So what should you as a clinician should do? First, allow the patient to sit on the dental chair in calm and relaxed position. Waiting time should be minimal. Avoid any sudden changes in the chair position. Now, dear students, some MCQs are framed from this topic. So please understand the topic thoroughly. Note down all the points for solving the questions. Now coming to the metabolic and endocrine diseases. This is a very important topic. Diabetes mellitus. Mark this topic as very important for chairside viva, both for the undergraduate and the postgraduate students. Some tricky MCQs are also framed from this topic. Not going into the details of diabetes mellitus pathophysiology and its types, I am talking about the oral manifestations and how to manage them while fabricating a complete denture. These patients show delayed wound healing. Clinicians should take care of any kind of injury during the impression procedure, like the sharp or the overextended impression trays, burn due to the hot impression compound or green stick. So alginate should be preferred over impression compound. Now this is a frequently asked multiple choice question. Overextended or unpolished record bases may become a source of injury or soreness in these cases. Then comes dry mouth or burning sensation of the mouth, which is also very common in these patients. Always remember, no saliva, no zinc oxide eugenol impression paste. This is a MCQ asked from the recent NEET exam. Impression paste is not used in xerostomia patients. Now, what other material can be used for final impression? Yes, silicones, polyether. Salivary substitutes can be given in the excessive xerostomia patients. Can you name any salivary substitute? Wet. Wet is a trade name of a salivary substitute which can be given in xerostomia patients. Now, this is asked during the viva. salivary reservoir dentures. They are maxillary special dentures given in the xerostomia patients. This is also one of the MCQ which is asked. Third is the increased alveolar resorption. This is managed according to the amount of residual ridge resorption present. I will discuss this in detail later. Hyperthyroidism. Females are commonly affected. Patients will tell you she is taking medicine for thyroid. You will have to ask increased or decreased. Ask for medicines, ask for reports. Okay. Now, challenges are almost the same. Decreased salivary flow. So, management will also be the same. In case of any mucosal inflammation, we give topical or symptomatic treatment. We should also avoid any source of injury in these cases. Hyperparathyroidism. Parathyroid hormone, it regulates the metabolism of calcium and phosphorus. This we know. It plays an important role in tooth and bone mineralization. It increases the bone resorption. Besides, severe osteoporosis can manifest as falling of the teeth at a very early age with excessive bone resorption. Now, this patient was just 45 years of age when I made his complete denture, and this was his third denture. He became edentulous around the age of 30. Can you see the excessively resorbed lower ridge in the intraoral picture? We will discuss in detail the steps of making the denture in excessively resorbed ridges later. Pulmonary diseases are very common in elderly patients. Emphysema and chronic bronchitis. These both lung conditions come under COPD, that is chronic obstructive pulmonary disease. Patients have chronic cough, shortness of breath and wheezing in these conditions. Patients with these ailments have little respiratory reserve and unable to endure the stress. Clinicians should make sure of short appointments for them. Ask the patient to use lift instead of stairs if the clinical area is upstairs, or make them relax for some time before starting the procedure. Then the dustless alginates or silicone materials should be the preferred impression materials for them. Examiners can ask you about this if your patient, especially if your patient coughs during your chairside viva. So be prepared. For asthmatic patients, afternoon appointments should be scheduled as the patients are more prone to asthmatic attack early in the morning. This is a common question asked by the examiner. It is also one of the important MCQs for the post-graduation preparation. Besides, the asthmatic patient should be asked to carry the inhaler or the medicine always along to the dental clinic. Nutritional deficiency. Vitamin deficiency tends to lower the defense mechanism of the mucosa, increase the chances of infectious diseases. These diseases become virulent in these cases. Mucosal lesions, angular cheilitis, ulcers may be present. For these, the vitamin complex supplements should be prescribed to the patients. Then topical applications can be given for the symptomatic relief of the lesions. If we talk about the nutritional deficiencies, the vitamin A causes hyperkeratosis, vitamin B causes angular cheilosis, vitamin D causes alveolar atrophy, vitamin K causes mucosal lesions. It is a very important topic for the postgraduates. Long or short note can be asked from this topic for the postgraduate students. Postgraduates can read the article of JPD 1965 by Dr. J.V. Barron, Nutrition of Edentulous Patients, or JPD 1970 by W.O. Ramsay, The Role of Nutrition in Conditioning the Edentulous Patient, to prepare this topic. If the patient gives the history of radiation therapy, then what? Patient may have osteomyelitis and hard and soft tissue necrosis. sore spots which are present that promote the radionecrosis. It's better that dentures should be avoided or used on limited time basis because it increases the tissue damage and necrosis. Xerostomia. Xerostomia has to be treated symptomatically. Static or dynamic bite openers can be used for the trismus patients. The golden rule to follow for these patients is that if the tissues are still bronze color and they lack tonus, denture construction should be delayed. Approval by the radiotherapist is also very significant in these cases. A postgraduate student may be asked about this topic. A general idea about the drugs and how it affects the oral cavity should be learned. Like xerostomia is caused by many drugs, many medicines like anticholinergic, antidepressant, antipsychotic, diuretic, hypertensive, sedatives, and many other which I have mentioned on the slide. Changes in the oral flora is mainly seen with the antibiotics, especially the broad spectrum group. Then possible mucosal changes are seen with the Dalton therapy. Siluria is seen in cases of anticholinesterase or adrenergic drugs. Dysphagia and gagging is a problem due to the phenothiazine derivatives. And orthostatic hypotension is generally seen with the glycerol trinitrate therapy. Neurological disorders. In Bell's palsy, there is facial paralysis of the affected side, mainly due to the damage to the facial or the seventh cranial nerve. This we know. Deviation of the mouth opposite to the affected side is present in these cases. This is just opposite to what the deviation of the mouth is towards the affected side in hemimandibulectomy cases. This is often asked by the postgraduate students. Then the mask-like face due to akinesia is associated with the Parkinson's disease. There is difficulty in winkling, closing eye and whistling, as these all are related to the functioning of facial muscles. Drooling corner of the mouth, impaired speech is also present in these conditions. Xerostomia may also be associated. So we have to keep in mind all these conditions while we are fabricating a complete denture for these patients. The challenges we need to face in these kind of patients and how to overcome with the neurological disorders. First is the impression making. We know the patient's own movements are restricted, so manual border molding is needed. Then the occlusal plane. It is set according to the lip line. It has a slant, that is, it is dropped on one side. If we talk about the occlusion, which is very important factor for complete denture fabrication. So monoplane or lingualized occlusion may be preferred in these cases. Recording of one centric relation point is very difficult. So we can go for non-anatomic teeth in these cases. This is an important question often asked by the examiners. The occlusal scheme and the form of the teeth used in these cases. Now wax up. Slight over contouring on the paralyzed side may allow the paralyzed tissue to rest on the polished surface. This helps in maintaining the seal of the dentures. Osteoarthritis is the inflammation of joints that commonly affects the weight-bearing joints such as knees, spine and hips. Fingers and temporomandibular joint are secondary affected. Below 45 years, male are more affected than the females in the ratio of 2:1. In 55 to 65 years of age group, females are more affected than the males, and above 65 years, the ratio is 1:1. Hubbardin nodes, as you can see in the picture, they are the bony enlargements of the terminal joints of the fingers which are involved. it becomes difficult for the patient to insert and clean the dentures. So they will need assistance for the same. Then temporomandibular joint, though less chances of being involved, leads to painful mandibular movements. Then sectional or special impression trays are used in cases of restricted mouth opening. This is another MCQ which is asked. Jaw relations are difficult to record in these patients. Frequent occlusal corrections with selective grinding may be needed to, due to the subsequent changes in the joint. I again repeat, the medical history of the patient is very important. Number of viva questions for undergraduate and postgraduate are asked from this topic. MCQs also, I told you that, are framed. Besides, it's ethical and wise to take a proper medical history to avoid any kind of emergencies. Now we start with the dental history. It has direct influence on the complete denture fabrication. It is very important. Chief complaint. Divan's statement is cent% true that dentist should meet the mind of the patient before he meets the mouth of the patient. The chief complaint should always be recorded in patient's own words. You know that the patient are coming to us after their long journey in all the other departments. So their stories are long, but be patient and listen to them. This actually does magic. Now, this is a clinical tip. Coming back, this conversation with the patient helps the clinician to know his expectations and the priorities. It helps us to assess if the patient's expectations are realistic or not. It actually provides the information regarding the patient's psychology. Period of Edentulousness. We have to ask the patient when he became completely edentulous. This can be categorized as recently edentulous, that is less than 6 months, or long time edentulous, that is more than 6 months. Patients who have become recently edentulous, that is less than 6 months, they tend to believe in permanence of denture. They have difficulty in acceptance. They try to continue with the same eating habits. We need to counsel them and explain the differences between the natural dentition and the complete denture. Dear students, can you see the picture of maxillary edentulous ridge? It has spicules. In some cases, sharp spicules are present. So alveoloplasty is advised. You know what is green ridge? Green ridge is the ridge with bony spicules, fresh ridges, which is not completely filled with the bone. Now, do you know what is green strength? Yes, it is the wet strength of the gypsum. Both are very important multiple choice questions which are asked during the preparation. Now, coming back, the patients with recent edentulous ridges will need frequent adjustment and relining. Long time edentulous patient, 6 months to many years. Two kind of patients you will find in this category. They may be denture wearers or non-denture wearers. Denture wearers need to be understood. Their eating habits with the previous or the existing denture. Their experience will reveal their psychology and adaptability. More alveolar resorption may be present in such cases. On the other hand, the non-denture wearers, they may indicate either lack of motivation, fear, or dislike for the dentist, or failure to appreciate the importance of teeth. These are the patients who have undergone extraction long back but are not wearing dentures. So the reason needs to be ruled out. Then you have to ask the reason for extraction. The common reasons may be caries, periodontal, pathology or trauma. If the reason was pathology or trauma, These patients are already in a psychological distress and are unhappy. They may also be accompanied with alveolar ridge defect, hard or soft palate defect, or hemimandibulectomy. So dear students, can you see the image with the partial hemimaxillectomy? So prosthesis like complete denture with obturator or meatus obturator are fabricated in these cases. This is one of the MCQ which is asked during the preparation. Coming to the more common reasons like caries and periodontitis, patient will tell you either the teeth were loose, that indicates a periodontal reason, and if the patient says decayed teeth, that only roots were left and needed extraction, indicates caries as the cause. Now, why the reason is important for us? Amount of alveolar bone remaining would be greater for a patient with a history of tooth loss from decay, as you can see in the first picture, while the bone resorption is more for the patient with a long history of progressive periodontal disease, as you can see in the second picture. The questions need to be asked for a already denture wearer are you already wearing a denture? Or any previous denture fabricated but not worn by the patient? How many dentures have you already worn or fabricated? Patient may have got 2 new dentures but wearing the oldest one. So this shows his limited adaptability to the new denture. For how long the patient is using the existing denture? Are you satisfied with them or not? Ask the reasons for the satisfaction or unsatisfaction. This will give an idea of his or her expectations from the clinician. Their all answers will depict the mental attitude of the patient and his expectations. Thank you so much, my dear students. Best wishes for your exams. Please like and share the video. Press the bell button for notifications and subscribe for more learning. You can give your feedback and mention your topic of interest in the comment section or at drshwetaprostho@gmail.com.